Today I'm going to talk to you about trauma and its effects on the brain and the body. Trauma can be referred to as a deeply distressing or disturbing event that overwhelms a person and their ability to cope. This leaves them with feelings of helplessness and being fearful and even horror. Trauma's effect on the brain really has to do with its functioning. And specifically actually in the areas of emotion regulation, memory processing, and stress response. The amygdala, which is responsible for producing emotions such as anxiety and fear, can go into overdrive. It can be overactive, producing lots of a variety of heightened emotions. The prefrontal cortex, which is responsible for regulating all these emotions and making decisions, that can really, it can really struggle to try and manage everything that's going on emotionally. In addition, trauma affects memory itself. So the formation of memory, the retrieval of memory can be, even the traumatic memory itself can be fragmented or seem incomplete. As far as trauma's effect on the body, it's really a stress response, which leads to the release of stress hormones such as adrenaline and cortisol. In the short term, that looks like increased heart rate, sweating, shallow breathing. But long-term, chronic exposure to stress hormones can lead to long-term physical problems. They can contribute to things such as hypertension, cardiovascular disease, immune system dysfunction, and also gastrointestinal problems. If your child has experienced trauma, these are some helpful things that you can do for your child. First thing would be create an environment, create a relationship that is open, that is supportive, that is safe for your child, where they can express how they are thinking and what they're thinking and how they're feeling without the fear of being punished or being judged. And also where they know they're going to receive unconditional love and support. Secondly, encourage communication, having open communication where your child can express in their own time and their way how they feel and the experiences they've had, and you are just there, present, being attentive and patient is really helpful. Thirdly would be to seek out professional help. And that would mean seeing a therapist or a counselor who is specially trained to know how to help children who have experienced trauma. In this environment, children can process what's happened to them, and they can also build coping mechanisms to help them manage their emotions. A really easy thing to do, very practical thing to do, would be to establish daily routines. Routines provide a level of stability and predictability that really actually brings a lot of comfort to a child who has experienced trauma. In addition to that, promoting self-care. So this would be doing things that are fun and relaxing. Things like exercise, or being in nature, doing art, or practicing mindfulness. These are all things that help a child to learn how to have habits that reduce their stress and help them manage their emotions. Next would be to educate yourself on trauma. An educated parent is one who is available and ready and knows what the child needs and is able to perceive that and be a real help and a support. And lastly, I would say, be patient. Be able to validate, be patient and understanding that this is a process. This is a process that takes a decent amount of time to work through. And validating your child's emotions and feelings is going to be really helpful, but also letting them know they can just take it a day at a time, and that's all right. Today we have discussed trauma and its effects on the brain and the body. We've also discussed ways that you as a parent can help your child with their trauma. If you as a parent can create a supportive environment where the child feels safe, establish effective communication that's healthy, and a connected relationship. Seek professional help. You can help your child navigate the healing process and also build resilience in the face of trauma.